Welcome to this edition of the Designs for Health audio science article.
There has been a significant increase in the incidence of autoimmune disorders over the past several decades. If we know what causes the immune system to attack itself and some of the triggers that cause a malfunction in the immune system, we can successfully assist with these conditions. Autoimmunity can occur in a few different ways. First, there can be a mistaken identity and the body attacks itself. This can occur with a virus where tissue destruction has occurred, appearing foreign to the body. The second way is called molecular mimicry. This occurs when the body makes an antibody, which is a protein that attacks objects in the body that appear to be foreign, to a specific antigen. These antigens can resemble certain proteins in the body, causing the antibodies to attack our body's own tissues. The third is by the development of T lymphocyte cells. This can be affected by genetics, stress, and environmental triggers. Addressing environmental triggers is one of the main areas integrative practitioners focus in functional medicine. These can be food-oriented triggers, such as gluten or other common food sensitivities that can trigger inflammation, as well as toxins or molds that may be present in foods. Patients' nutrient status, such as antioxidants, vitamins, essential fatty acids and minerals, gut health, and total toxic burden are also critical aspects of physiology to address when trying to seek the root cause of symptoms. According to a study from the University of Michigan, one of the greatest risk factors for autoimmunity is exposure to mercury. This study found that mercury exposure, even at low levels that are generally considered safe, was associated with autoimmunity. According to the lead author of the study, exposure to mercury stood out as the main risk factor for autoimmunity. Autoimmune diseases such as inflammatory bowel disease, lupus, Hashimoto's thyroiditis, Sjogren's syndrome, rheumatoid arthritis, and multiple sclerosis are among the top 10 leading causes of death among women. After analyzing data from the National Health and Nutrition Examination Survey between 1999 and 2004 among women ages 16 to 49 years, researchers discovered that greater exposure to mercury was associated with a higher rate of autoantibodies, which is a precursor to autoimmune disease. Most autoimmune diseases are characterized by autoantibodies where the immune system fails to distinguish between its own tissues and potentially harmful cells. Most recommendations on fish consumption are targeted at pregnant women, nursing moms, and young children. Researchers note that while seafood offers many health benefits and essential nutrients, as a lean protein, their findings provide evidence that women of reproductive age should be cautious of the type of fish they consume. Fish such as swordfish, king mackerel, tuna, and tilefish contain the highest levels of mercury, whereas smaller fish such as sardines, anchovies, herring, sockeye salmon, shrimp, and other shellfish have lower levels. The presence of autoantibodies doesn't necessarily mean it will cause autoimmunity or lead to an autoimmune disease. However, it is important to recognize autoantibodies are significant predictors of future autoimmune disease and in many cases precede the symptoms and diagnosis of the disease by years. This is definitely a factor that should not be overlooked. Various specialty laboratories offer whole blood and urine panels that can assess current heavy metal exposure or heavy metals in the tissue. Dental amalgam fillings are also a common source of mercury exposure. There are many natural agents that can safely support the detoxification of heavy metals without the harsh side effects of common synthetic chelating agents. These include chlorella, reduced glutathione, N-acetylcysteine, alpha-lipoic acid, garlic, cilantro, and modified citrus pectin, which is a complex polysaccharide that works to bind to heavy metals without depleting essential minerals from the body. Supplements containing these compounds are designed to support the normal process of heavy metal detoxification from the body. These ingredients work together to reduce the initial absorption of metals into the tissues and organs, pull them out more effectively, and help to decrease their reabsorption into enterohepatic recirculation.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.